Hello, my name is Sarah Rutherford and I am an assistant professor of medicine at Weill Cornell Medical College. I'm going to talk to you today about a journal article entitled Prognostic Significance of Geriatric Assessment in Combination with Laboratory Parameters in Elderly Patients with Aggressive Non-Hodgkin Lymphoma, written by Dr. Aldrich and published in the Leukemia and Lymphoma Journal. The most common type of lymphoma is diffuse large B-cell lymphoma, and it is cured in about 2/3 of patients with the chemotherapy regimen R-CHOP. This treatment is given for 6 cycles over about a 4-month period. The median age of diagnosis of diffuse large B-cell lymphoma is 65 years, and many patients are even older than that at diagnosis. As you know, older patients may have other medical problems, may be on multiple medications, and they may have functional impairments and problems with nutritional status as well. In recent years, there has been a movement in medicine in general and in oncology specifically to develop geriatric assessment tools in order to better manage older patients. This study included 44 patients who were diagnosed with aggressive non-Hodgkin lymphoma, primarily diffuse large B-cell lymphoma, who had been deemed fit for R-CHOP chemotherapy by their treating oncologists. The median age of patients in this study was 78, and over half of the patients were 80 years old or greater. They underwent assessments for their nutritional status, their functional ability, and their cognitive ability, and their performance status was also recorded. Laboratory parameters including hemoglobin, which is a marker of low red blood cells or anemia, albumin, which is can be a marker of poor nutritional status, and then kidney function was all recorded. It was found that 75% of the patients in this study completed the treatment, and about a quarter of those patients did not. And those 25% of patients that did not complete the study were more likely to be frail, have poor nutritional status, and have anemia or low red blood cells. Over half of the patients died from the lymphoma itself, indicating that it is very important for these patients to complete the full 6 cycles of R-CHOP, if possible, in order to cure the lymphoma. The take-home message for this study is that geriatric assessment can be very helpful in determining which patients are suitable for the full regimen of R-CHOP. There is a dose-reduced version called R-mini-CHOP, which may be more appropriate in some patients. However, there is not a clear standard in which tools should be used for geriatric assessment, and further research will help to reveal this in the coming years. It is important to remember that this study included only 44 patients, which is a small number, and that these patients had been deemed fit by their oncologists to receive the R-CHOP chemotherapy, which means that they were not reflective of all patients diagnosed with diffuse large B-cell and other aggressive lymphomas. You may be asking yourself, what should I do if I'm a patient with diffuse large B-cell lymphoma or another similar type of lymphoma? Well, it is very important for you to bring a family member or friend with you to appointments, and that your physician have an accurate understanding of your functional ability as well as your other medical problems and medications. In addition, you should be sure to take advantage of all resources offered at your cancer center, including nutritional assessment and consultation, physical therapy and occupational therapy referrals if available, and support groups, which can help you get through the treatment as well. Thank you.